Let's start off with the United Kingdom. It imposed tougher restrictions across England in an effort to prevent two mutant strains of the coronavirus from spreading. The British Health Secretary, Matt Hancock, says a second wave or second new variant of COVID-19 has been detected in travelers coming from South Africa. Countries across the world who have already banned flights from the UK have now extended it to South Africa travelers.
We are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible and it appears to have mutated further than the new variant that's been discovered in the UK.
Babak Javid is here, and he's an infectious diseases associate professor at the University of California at San Francisco. Professor, thank you for joining us. Tell us first, are these concerns over the new mutations justified?
I certainly think we do need to be a tad cautious. There are compelling data from the UK that the UK variant is certainly more transmissible at the moment. The data from South Africa are less complete, but certainly some of the mutations match, and it would certainly be plausible that they're more transmissible. So I do think we do need to have, a degree of caution. That doesn't mean that, for example, vaccine efficacy and so on will necessarily be impacted.
So vaccines may not be impacted, but does it affect testing as well?
So that's a great question. In the UK, actually, one of the reasons this variant was picked up was that in Britain, the tests for three different parts of the SARS-CoV-2 virus genome, and the UK variant caused one of the three tests to come up negative, so it was very easy to spot. That isn't the case for the South African variant, and in fact, in America, the majority of tests used, to my understanding, wouldn't pick up the variant so easily. Having said that, it will vary a little bit because there are so many different PCR tests being employed at the moment throughout the world.
Correct. There are so many variants of the testing. Now, FDA Commissioner Stephen Hahn was on Bloomberg TV today. I want you to take a listen to what he said.
We need to get to the point where we have herd immunity in the United States, frankly, around the world, to stop the spread of this virus. And experts think that's 70 to 80% of the population vaccinated or have had the disease.
Now, my question to you is, would a higher proportion of the population need to get the vaccine in order to achieve herd immunity now?
That's a really critical question, and I think we don't fully know the answer, if I'm honest with you. Certainly, if the virus variant is more transmissible even in the absence of control measures, that would suggest a slightly, not massively higher, a slightly higher proportion of people would need to be immune to achieve some level of herd immunity. But there's a lot of uncertainty around that. And certainly it's not that you suddenly go from 70% to needing 90, 95% immune. It would probably be from 70 to 75% or something along those lines.
Okay, that makes sense when you look at how these things continue to rise. But one more thing. You've argued that the mutations have actually helped researchers track the virus. Why is that?
As I said, in the UK, the most commonly used test for confirming SARS-CoV-2 infection or COVID infection picks up three different parts of the genome, and one of the three targets the part of that this variant is mutated. And so actually you'd only get 2 out of 3 positive instead of all 3 positive. That allows you to track the virus in real time, which is really quite extraordinary. But the same tests aren't widely used in the US as far as I'm aware, so you wouldn't necessarily have the same amount of real-time information. And the other issue is that the UK has really led the world in terms of genomic surveillance, in terms of actually sequencing the entire genomes of the COVID virus. Proportionately, the US has sequenced far fewer strains, and therefore there might be a lag before we realize whether this variant is extant in the US or not.
Professor, I wonder, though, if vaccine makers are coming up with some alternative plans based on this new information.
As far as I'm aware, and I'm only aware, I only know publicly available information, there are no plans right now to make any changes. But I did read an article where the CEO of Pfizer said that if required, and he said if required, he was confident it's not likely to be required, they could tweak the sequence for the mRNA vaccine that Pfizer and BioNTech use within a 6-week time window. And that's one of the advantages of this new technology for virus delivery with these mRNA vaccines, is that they sort of have a plug and play strategy that you can change the type of vaccine very easily and very quickly.
Okay, Professor, and also this question. Is this normal for these mutant variants of the strain just to continue coming out like this? How normal is this?
Absolutely, and this is actually probably what we should have talked about first, and that is that all infectious agents, in fact, all living organisms mutate over time, and this is completely normal. In fact, there are more than 1,500 known variants of SARS-CoV-2 already that have been mapped. What's important is that the vast majority of those variants will have either no effect on the virus function or will make it less able to spread. What does seem to have happened here is that at least one of these two variants, and possibly both of them, may have an increased tendency to spread. And obviously that does warrant some caution. I don't think it means panic stations by any means.
All right, we'll leave it there. Babak Javid, professor from the University of California, San Francisco. Thanks for joining us.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.